Mental health remains a top priority in Montgomery County, and recently, Council President Kate Stewart brought together more than 130 providers and service professionals for a special convening aimed at strengthening mental health support.
We also know that as we're looking at investing in our mental health, it's not just about treating illness, but about promoting wellness in our community and having a holistic approach to mental health. And that we want to look at not just the crisis part of mental health, but also look at how we can do prevention and intervention to reduce the stigma.
The event highlighted key programs already making a difference, like the DHHS Youth Safety Initiative, which takes a holistic approach to addressing youth mental health and substance use.
For the last year or so, I have been leading the county's Youth Safety Initiative, which has kind of ebbed and flowed over several decades, but it started in response to a rise in youth violence. And when we looked at that a little bit closer, we saw, well, it's not just a rise in youth violence, there's a rise in youth self-harm and suicidality and substance use. And rather than looking at those in isolation, that speaks to something going on with our youth, and we need to be looking at it collectively.
Montgomery County Public Schools also deploys student well-being teams across 211 schools, offering crucial support for students.
MCPS has been a really great partner on the Youth Safety Initiative and a lot of the work that we do for this initiative specifically, but also more generally in focusing on kids.
All that data and all the real faces and children and young adults behind that data, they don't just stay out in the community. They all come through our schools, right? So MCPS, really, public schools in general, are one of these last great public squares where you have people from all walks of life, from various cultures. The beauty and diversity of our county and community comes into our schoolhouse every single day.
Shepherd Pratt is the nation's largest private nonprofit provider of mental health, substance use, special education, developmental disability, and social services. We serve over 70,000 people every year.
At the end of the convening, participants shared their key takeaways, reflecting on insights gained and strategies to implement moving forward.
We talked about the lack of education to mental health, so there's a lot of denial between the youth. They think they're just fine, but we recognize the signs. There's eligibility. You have to be diagnosed with something in order to receive certain services. And it's really hard to navigate mental health services.
Stigma. From how we think about it, how we've experienced, we think everybody else's experience is the same or should have been better, whatever, and the language that we use. And everybody in here that has ever met with me in any room has heard that from me.
Transportation, we see bus stops everywhere, but like to get to our services, you need to take a bus to a train to a bus, and heaven forbid it's raining. I mean, it can be difficult. And then one thing that we talked about was the family or the caregiver/parents, their time and income.
Moving forward, Council President Stewart says the county will build on these efforts, launching a mental health video series to spotlight local programs and hosting more community conversations to ensure all voices are heard.
When one person thrives, it creates a ripple effect, fostering resilience and connection and collective growth for everyone.
For more resources and updates, residents can check out the Mental Health Corner and Council President Stewart's newsletter, available in multiple languages. If you haven't already signed up, you can sign up to receive her newsletters by scanning this QR code. Reporting in Fairyland, I'm Rashai Sahalu.